Tachypnea means rapid ventilation, so rapid breathing. So when the amount of oxygen in the blood drops, there is an attempted respiratory compensation. You're going to breathe faster to try and get more oxygen in. And in terms of the oxygen flux equation, what we're trying to do is increase the saturation of oxygen. Now, S stands for saturation, A means arterial, O2 is the amount of oxygen. So this refers to the saturation of oxygen in the arteries. The amount of oxygen saturation, SaO2. And we often measure this peripherally with oxygen saturation probe, and we call that SpO2. That will be saturation of oxygen in the periphery, normally in a finger, using oxygen saturation equipment. So the rapid breathing is an attempt to increase the oxygen saturation of the arterial blood, and we often measure that peripherally using O2 SAPS equipment. The rapid breathing, the increased rate of breathing will increase respiratory volumes. More oxygen is going in and out of the lungs to increase arterial oxygen saturations. And of course, as we've noticed, by the way, carbon dioxide increase will also stimulate breathing, but that will happen. The increase in breathing as a result of the hypoxia will still work independently of this, although in practice, of course, both do tend to go together and both are stimulating respiratory effort. But the idea is the tachypnea, that's what we look for, and we know it's to try and increase arterial oxygen saturations.